Hello everyone, we welcome you for your induction program at SNEH Foundation, helping children creating future. SNEH Foundation. SNEH name itself means solid nutrition, education and health. SNEH Foundation is a non-governmental organization which was established on January 3rd, 2011 by Dr. Pankaj Bohra. We have initiated this organization with the mission to ensure excellent early childhood education, nutrition, and health for every child in India. SNEH Foundation was established with the vision to make underprivileged families cognizant of the benefit of a nutritious meal, provide equal means and opportunities for education to the underprivileged children, spread awareness pertinent to the health issues. So, SNEH Foundation is currently running 4 projects and is now actively working on 4 domains under SNEH Foundation. First domain is a nutrition, that is Poshan. Second is education, that is Gyan. Third is Vatsalya, or a physical health. And the fourth one is a mental health, that is Manasik Arogya. So the nutrition, our first initiative. Nutrition program was started with the aim to eradicate the horrors of malnutrition from underprivileged section of the community. Under nutrition, we have project which is named as Addressing Malnutrition, and it is running with the collaboration of SNEH and Tata Motors. Till this year, about 2,173 plus malnourished kids were intervened. This project was running at the PMC region earlier, and now it is actively running in the PCMC region. So in the PMC region, Komal, that is Combat Malnutrition, SNEH Kothru project. Under this project, we have intervened about 300 kids. And under Malnutrition project, we have reached about 50,000 plus beneficiaries through community awareness. Our second project is education, that is GAN. It was initiated with the aim to provide high quality pre-primary education to the kids from the most marginalized section of the society. So under SNEH Preschool, we had about 1,855 plus kids recruited under our preschools. We had initiated one of the project in Kalakhada, a region where 100 plus kids were recruited under education project. Along with that, we had initiated a grant, that is Delhi chapter project, with 100 plus kids recruitment. So our next domain is physical and the mental health. Under physical health, we have initiated a Vatsalya project with the collaboration of SNEH and Viprocast. Vatsalya project was basically initiated with the aim to address health issues that we come across in the field and provide medical guidance to the beneficiaries and if required, monetary help. Under Vatsalya project, we have reached to about 995 plus beneficiaries. Under this project, we have formed MAS, that is Mahila Arogya Samitis. About 58 Mahila Arogya Samitis were formed in the PCMC region. Our next initiative is a mental health, that is Manasik Arogya. This project is basically a community awareness based project. Under this project, we have reached about 2,000 plus beneficiaries through awareness. So now initiating our first project, that is Poshan, Addressing Malnutrition. So this project was initiated with the objective to ensure sustaining health of malnourished children below 5 years of age through building awareness and interventions in the community. The background for this project is basically urban slum of a PCMC region is only included in this project. Along with that, kids are identified based on a predefined criteria for malnourishment. The funding is received from the Tata Motors Pune, and this project has been running successfully from the past 9 years. So how we do it? So this project has 4 main basic pillars. First is the social workers, second is nutrition, third is our model, and fourth is the sustainability. So with the social workers, our community link workers, that is CLW, provide intervention for children with acute and the severely malnourishment. Our second thing that we do under this project is to provide ready-to-use therapeutic food or ready-to-use supplementary food to all the malnourished children to help them to get from a malnourishment zone to the healthy zone. The model or the guidelines that we follow under this project are from the UNICEF or WHO CMAM model. Every project has a sustainability approach, and every project is successful only when you work hardly on the sustainability part. So under this project also, we have a sustainability model where constant medical monitoring by doctors and robust awareness programs are conducted and the sustainability approach. So the impact of the addressing malnutrition project. Till now, we have identified about 2,000 plus malnourished children and from 15 plus slum pockets since 2014. About 91% of the children have moved to healthy zone in the last 9 years, and 50,000 plus beneficiaries were indirectly impacted by conducting street plays, digital sessions, recipe sessions as a part of awareness. Our next initiative, that is education. So under education, we have a SNEH community preschools. The objective of starting the SNEH community preschools was to provide quality education to the underprivileged children at an affordable cost. So background for this project is, this project was inaugurated by Honorable Member of a Parliament, Shri Gajanan Baba, on the Republic Day of 2030. We have initially started this SNEH preschool with the 25 kids. The student strength doubled in just 1 year and now has grown 20 times in the last 8 years. Currently, we are operating this project from 8 branches in marginalized communities. Total strength in 2022 to 2023 is about 450 plus kids. I have been recruited in our SNEH preschools in nursery, junior KG, and senior KG. Currently, we are actively running these SNEH preschools in the PCMC region and the PMC region of Pune. So, what is the model of this project? So, here are 4 main aspects of this project. That is, first is the key points. Second is the unique aspect of a SNEH preschool. Third is our model, and fourth is the sustainability aspect. So, key points under this project are 1,855 plus kids have been enrolled from 2013 under nursery, junior KG, and senior KG classes. Our primary beneficiaries are the families below poverty line, and our target age group for this project is children from the age of 3 to 6 years. The model for this project is a sponsorship model. Every kid's education is partially sponsored by well-wishers. The well-wishers are also called as a SNEH change makers or sponsors who pay 70% of the fees for children and 30% fees is taken by the children parents. So our third aspect, that is unique aspect of this project, is we have activity-based learning using smart tools. A rigorous screening process is done to identify most eligible or the needy kids from the slum population. We have visits by SNEH volunteers to monitor the progress of the children. Regular health checkups for all students is conducted in every branch of our preschool, and free admission is given for the families who cannot afford the fees. The sustainability aspect for this project is we usually focus more on the parents' counseling sessions to groom kids at home as well. We prepare parents to be knowledgeable enough to check the assessments of 4 kids, counseling of a parents for outgoing kids on RT, that is Right to Education Act, and focus attention for tie-up with the schools for RT, that is Right to Education Act admissions. So impact of SNEH preschools. Till now, we have 100% kids of a SNEH enrolled in a primary education. More than 90% have recruited through RT in the very popular and the renowned international schools. 100 plus sponsors have come together to support our education program, and 1,855 plus underprivileged kids enrolled under SNEH preschools. Our third initiative, that is Project Vatsalya. Initially, the Project Vatsalya was started in 2017 to address the health issues in adolescent girls and mothers with the objective to provide affordable healthcare services to the underprivileged children and mothers. The main background or the main reason of starting this project is to link the government policies related to the maternal and child health to beneficiaries for a reproductive health and other components, link community and facility-based care as well as referrals between various levels of a healthcare system, create a continuous care pathway, and bring an additive or synergetic effect in terms of overall outcome and impact. From 2017 to 2019, we used to identify adolescent girls and females with the anemia in a PCMC schools and community along with the awareness and interventions. Basically, the females in the slums who are just married, pregnant, or have delivered a child has been recruited under this project from 2017 to 2019. Our research was to find the government programs and initiatives that fall in line with the project's mission to improve maternal and child health in urban slums of PCMC, refer cases to the government hospitals, and having a tie-up or partnerships with the government hospitals for a referral system. We used to ensure our sustainability through awareness regarding the government policies for mental health through fortnightly sessions, follow-up of the identified cases, till the mother and children are healthy, devise a strategy to provide low-cost healthcare to the community. This project has grown to some extent, and in 2019, the project Vatsalya was started with the collaboration of our CSR partner, who are Wipro, and we are running this project from 2019 to till now with the collaboration of Wipro. Our aim to start this project and extend it to the broader level was to reduce maternal and child mortality rate and prevent malnutrition in upcoming generations. Our objective for this project was to create awareness among pregnant mothers, lactating mothers, and adolescents about various health aspects, link the government healthcare policies and facilities with the community beneficiaries, and we are getting funding from the Wipro Pune. The project has been running successfully from the past 3 years. So how we do it? Again, we have our own model to run Vatsalya project, where CLWs, that is community link workers, provide interventions for pregnant and lactating mother through various awareness sessions, medical campaigns, medical screening, and referral systems. We have other aspect, that is nutrition. Under this, we do counseling on iron-rich diet, IFA, and calcium tablet distribution, and connecting them with the government healthcare workers. Our model is this model is rely on the regular home visits for all the beneficiaries. Monthly awareness sessions are planned for all the beneficiaries and the other community members to promote healthy lifestyle. Along with that, the sustainability approach has been done with the trained Sakhis, that is community-based volunteers we recruit in each community. She continues the interventions on a voluntary basis after the completion of our project. So the process map for this project is basically, first we identify the beneficiaries through door-to-door survey. Then we take their demographic profile through household survey and the pre-test form, that is the basic understanding or the knowledge about the health has been identified through these pre-test forms. Once the beneficiary identification is done, we go ahead with the anthropometry measurements, where we measure height, weight, BMI, that is body mass index of a pregnant mothers, lactating mothers, and the children. Once the anthropometry measurements are done, we go ahead with the medical screening, where the ANC mothers medical checkup gets done on a tri-monthly basis. Hemoglobin camp were conducted for pregnant mothers, lactating mothers, and adolescents. With the medical screening, we go ahead with the medical interventions where we provide IFA, that is iron and folic acid tablets, calcium tablets. We provide iron-rich food for anemic beneficiaries, promote safe abortion practices, and provide medicines by doctors. Awareness sessions were conducted by forming a pregnancy club at the community level. Also, we conduct awareness sessions on a monthly basis for pregnant mothers, lactating mothers, and the adolescent. Along with that, the major part of this project is the home visits, where on a daily basis, the counseling gets done to the beneficiaries on a required topic which are related to the health or the other uh, topics. So the impact of a SNEH Vatsalya. That is, we have identified about 1200 plus adolescents and intervened them for an anemia. 910 plus mothers are directly are direct beneficiaries for awareness and monitoring on antenatal, postnatal, and the neonatal care. 590 plus medical checkups are done by our healthcare group in the community. So our fourth domain and the most important project is community mental health project. The SNEH Foundation has initiated this project with the collaboration of Wipro Cares under the guidance of the Baraku Trust as a community mental health project in two communities of a PCMC region, Pune, that is Anand Nagar and Ajinta Nagar, from July 2022. The objective of this project is to focus the objective of this project is to grasp the current understanding of mental health and psychosocial disabilities in the community. The project further involves early detection of mental health issues and psychosocial interventions on the same, based on inclusive and right-based approach. Along with that, our third objective is to create awareness among the beneficiaries and stakeholders also is one of the major aim of this project. We have completed initial research phase and I have begun with the implementation plan. So the community awareness and a client identification process. So how we do it? Firstly, we started awareness events to create a rapport at the ground level, where these awareness events were taken as a corner meetings, 1 minute anchoring, poster exhibition, Saltha Boltha, Gali Charcha, Varta Falak awareness sessions. Once the awareness events are along with the awareness event, we have started the client identification, where the mental health related clients were identified and forms get filled. First client visit were taken where the address get cross-checked. Introduction of a community link worker supervisors gets done. One client visit is lasted for about 10 to 15 minutes. Once the first client visit gets done, first field visit gets started. After that, the second field visit gets started, and with the second field visit, we started for the general inquiry. Window assessment gets done, and the intervention plan discussed and client work plan as per the EPRFW. So these are all our running project. Now we are going ahead with the past successful project. So SNEH has done many projects which were successfully implemented at ground level. Among those projects, the first project was SNEH Women Empowerment Project. This project was continued in SCP's Anganwadis with the below motive to create an awareness, to promote employment, and to started the fund generation activity. Under this project, the sessions on digital literacy with certification program on a primary computer knowledge was taken, benefited more than 200 plus ladies till now, and de-scope to focus on education and health for kids. However, SNEH is connected with all the former beneficiaries. Our second successful project was implemented with the Anganwadis, where the collaboration was done with more than 50 Anganwadis to address different aspects of health. Scope of this project is now bifurcated into Komal and other health projects. Our third project was construction site project. Volunteers work on a children from 3 construction sites and develop the community to a better place through overall support and awareness. The kids have been enrolled to different schools and their progress has been monitored. Currently, this has been de-scoped. This will be covered under Project GAN. So, our one of the most important and the successful project from the past was Project GAN, Rise and Shine. The project was started with the objective to help the underprivileged kids by empowering them with the literacy, providing pre-primary education, and enrolling in schools recognized by Education Board and helping in their holistic development. The background for this project was this project started at the Kalakhada urban slum as a part of a routine survey, where volunteers started the weekend support classes for kids, and expanded to daily classes in the field of English, maths, science, arts, crafts, behavior training, etc. An initial screening process helps assess cognitive development of each child. Additional various activities for the benefit of the community, such as health checkup, street plays, donation drives, parent counseling sessions, were also organized. The impact of this project was 50 kids of age group 6 to 14 years were attending daily classes in the community, and the direct impact of this project was about 200 families across 4 Anganwadis were impacted through Project GAN, Rise and Shine. Our second successful project was Saving Promotion Project with Göttingen University, Germany. This project was initiated with the objective to test the effectiveness of interventions to promote saving among low-income households in the slums surrounding the city of Pune. The outline of this project was 750 randomly selected households will receive a sealed saving box, and 750 randomly selected households will receive a portable saving device in addition to the saving box. The research team investigates whether the saving devices can help to increase saving rates, reduce spending on temptation goods, and improve participants' overall well-being. So, to promote the saving promotion was done under this project. Our third successful project was the SNEH clinics. This project was initiated with the objective to provide affordable and accessible healthcare facilities by specialized doctors. The SNEH clinics was established at Kalewadi and the Kalakhadak slums, where our team doctors, including pediatrician, gynecologist, general practitioner, and physicians, provide services to the beneficiaries from a marginalized background. Not only do the doctors provide diagnosis and a treatment, but also conduct a lot of awareness sessions for the community members so as to increase their knowledge about healthcare and to change their attitude, behavior, and practices related to the same. During COVID time also, SNEH had done many COVID relief activities. The first was a grocery distribution in various regions of India. Second, telecommunication consultation was started for COVID-19 patients. Zoom sessions were conducted to create an awareness among the beneficiaries and the other people. Virtual skit presentation on a prevention and a precautionary measures of COVID-19 were conducted. Banner display and a rickshaw rally to spread awareness among the project areas were done. Teleconsultation and a referral to the health center were provided during the COVID time and post-COVID also. So these are the activities that we have conducted under COVID relief activity. Now, what are the activities that we have done or doing in the current progress? So our first is a donation drive. SNEH volunteers have been contributing for a donation drive in several areas and multiple communities to get individual donation as well as crowdfunding through website. Our partners for SNEH has a different organization, that is TCS Maitri, Cognizant Outreach, ZEP Rehabilitation Center, Nachiket Balgram Orphanage Center, Tehinam Burma Center for the Physically Challenged Kids, Takshashila Orphanage, Tata Motors Pune, Datri, Gunj, Bapu Trust, Viprocast, etc. Our microfinance. SNEH Foundation has been involved in providing microfinance to needy people in order to assist in education and health. Street plays. SNEHs have been organizing street plays on a sensitive social monsters such as drug or alcohol addiction, girl education, female feticides, health hygiene awareness, etc. So these are the other activities that SNEH is currently doing along with our running projects. So the impact of the activities that we have done in the past and currently doing. So we have received an appreciation from government ICDS, that is Integrated Child Development Scheme Department, for the contribution in the field of education, nutrition, and health in PCMC Pune. So under education, lives of 600 plus kids change through SNEH preschool. 300 plus kids have been admitted to different schools, 100 plus kids impacted under GYAN Delhi, and 50 plus kids under GYAN Kalakhada. Health issues, 100 plus free health checkup camps and medical checkups with the coverage of 500 families. Under hygiene domain, we have done liquid soaps and a towel. We have distributed liquid soaps and towels to 51 Anganwadis, 27 in PCMC and 24 in Kochur for 1,000 plus kids cleanliness drive for communities in urban slums, Vatsalya. Anemia, for anemia, HB tests for 1,200 plus anemic adolescent girls and mothers, and iron tablets were distributed. Antenatal and postnatal stages. 100 plus mothers were given services regarding maternal and newborn healthcare. Under empowerment, 150 plus ladies by imparting vocational training, job-oriented sessions, and English coaching were empowered. 1,000 plus malnourished kids in Anganwadis elevated to the healthy zone under nutrition aspect, and 80 plus kids have been helped at various construction sites under construction site project. So the awards and appreciations that we have received till now. The first was education, that is preschool. For our preschool, SNEH Community Preschools were ranked as one of the top franchises preschools in Asia by the Early Childhood Association Asia in 2020. Second appreciation that we have received for preschool was one of the top 10 promising preschools in India in 2019 by the Knowledge Review magazine. Our second project, that is Potion. For this project, SNEH Foundation received an award from Tata Motors for excellence in CSR project implementation in 2021 to 2022. Second appreciation that we have received for a Potion is SNEH Foundation has received a Best Paper Presentation Award at IAPSM and IPHA conference in 2020. Under health, that is Vatsalya project, which is oriented on a maternal and child health. First appreciation that we have received is D.Y. Patil Hospital appreciated SNEH's work during breastfeeding week awareness in the PCMC region and felicitate us during Lacticon conference in 2022. Our second was SNEH Foundation presented a paper on correlation between anemia during pregnancy and low birth weight in the children. Evidence was taken from the Vatsalya project at second edition of the International Nutrition Research Conference 2022 conducted in Rome, Italy. So how you can help us? We have approached with our four domains. First is volunteer. Volunteer can teach our preschool children or our RT children, help us to conduct a survey at a ground level, help us to manage our data by helping in a data analysis. Volunteers can participate in various events that has been taken under SNEH's initiatives. Along with that, volunteers can help for a follow-up from the beneficiaries. The second is doctors. They can help us to conduct a health awareness sessions at the ground level. Medical camps and HB camps can be taken with the help of a doctors as a volunteer. Third is a corporate partners. Volunteers can help us with to tie up with the long-term CSR partners, assistance in starting or maintaining the projects, well-wishers. So the well-wishers can help us to sponsor a child in the form of a book, education, or other essential that are necessary for the children or the beneficiaries under various projects. So various events that has been conducted by SNEH is sanitation drive at Kalakhada, street play at Balaji Nagar, counseling on anemia under Project Vatsalya, press release on breastfeeding month organized by SNEH, Tata Motors and PCMC, shoes or slippers donation drive, Diya stall in various corporates or the other places, street play actions with old cloth donation, Behtar India campaign, breastfeeding awareness events, Teachers' Day celebration in various preschools, HP camp conducted in PCMC schools, 15th August 2017 celebration program, Teachers' Day at Kalakhada, World Marrow Donor Day, blood donation camps, Christmas celebration, cooking competition at preschools, exhibition day, sports day at preschool, Women's Day celebration at Vatsalya, preschool graduation day, Pune NGO Leadership Award. Thank you. And we would appreciate you and wanted to take you part to be a part of a change with the SNEH. Thank you.